Today's topic is trigeminal nerve. This is the fifth cranial nerve, the largest cranial nerve. It comprises of three branches, of which two are purely sensory and one is mixed. The purely sensory one are the ophthalmic and the maxillary. And the mixed nerve is the mandibular nerve, which is the largest branch of the trigeminal nerve. The trigeminal nerve originates from three sensory nuclei and one motor nucleus. The three sensory nuclei are the mesencephalic, the principal sensory, and the spinal nucleus. This is midbrain, this is pons, and this one is the medulla. At the level of the pons, the sensory nuclei merge to form the sensory root of the trigeminal nerve, and the motor nucleus forms the motor root. In the middle cranial fossa, the sensory root expands to form the trigeminal ganglion or the semilunar ganglion or the Gasserian ganglion. This ganglion is present at the apex of petrous temporal bone in a cave which is referred to as the Meckel's cave. The peripheral aspect of the trigeminal ganglion give rise to three divisions: the ophthalmic, maxillary, and the mandibular. Motor root passes inferiorly to sensory root along the floor of the trigeminal cave, and it distributes only to the mandibular nerve. That is why the mandibular nerve is a mixed nerve. The ophthalmic nerve exits the cranium through superior orbital fissure. The maxillary nerve exits the cranium through foramen rotundum, and the mandibular nerve through the foramen ovale. Let's learn about the ophthalmic nerve. It's a sensory nerve. It has three branches: the frontal, nasociliary, and the lacrimal. The frontal has further two branches, the supratrochlear and the supraorbital. The supratrochlear supplies the upper eyelid, the conjunctiva, and the lower part of the forehead. The supraorbital supplies the frontal air sinus, upper eyelid, forehead, and the scalp till the vertex. The nasociliary has the branches, the posterior ethmoidal, long ciliary, branch to the ciliary ganglion, infratrochlear, and the anterior ethmoidal. The posterior ethmoidal supplies the sphenoidal air sinus, the posterior ethmoidal air sinuses. Long ciliary is sensory to the eyeball, and the infratrochlear supplies both the eyelids, the side of the nose, and the lacrimal sac. Then comes the anterior ethmoidal that supplies the middle and anterior ethmoidal sinuses, the medial and the lateral internal nasal, and the external nasal that is supplying the skin of the ala of the vestibule and the tip of the nose. So this sums up the ophthalmic nerve. Next, let's come to the maxillary nerve. This is also a sensory nerve. It has further branches. In the middle cranial fossa, it has the meningeal branch. In the pterygopalatine fossa, it has the ganglionic branch, the zygomatic branches, that is the zygomaticotemporal and the zygomaticofacial. And the last one is the posterior superior alveolar. Then comes in the infraorbital canal, it has the middle superior alveolar branch and the anterior superior alveolar branch. On the face, it has the terminal branches, the palpebral, the labial, and the nasal. This completes the maxillary nerve. We'll discuss about the mandibular nerve in the next session.